So the question that usually comes up is whether pain is just a hallucination. And like I said before, I hate that idea because it takes the reality away. And in a way, it blames the victim. It makes it sound as if you're just making this up. You really just want attention. You don't have any reason to be hurting so much. Maybe you should see a psychologist instead. Those kind of things are still being done, even by medical doctors who plainly should know better because this is not really new. We know about these facts in neurology for the last at least 15 years, if not longer. So, particularly professionals who work with pain a lot should be aware. What is really happening in regards to hallucinations is the creation of reality. We know that people who have hallucinations, when we put them into the fMRI machine, where we can really follow which areas in their brain are lighting up, that these areas are the exact same, whether they're hallucinating or whether they're really seeing something. The process in the brain is identical. And that is why people who have a psychosis cannot distinguish between the psychosis and the hallucination created by that and the real world out there. Now, of course, that had to be evaluated a little bit more. And what we found out is that we all create our own reality. So a hallucination is really nothing but the perception and interpretation of reality that is not congruent with the perception and interpretation of reality of the people around us. So when we don't agree with other people about what we think we see out there, then it's a hallucination. The process inside the mind is the exact same thing. So it really just depends on whether there is agreement or not. Now, I know this sounds a little bit odd and crazy because you know what's real, right? You know this house that you see there is real. But we know from optical illusions that what we actually see is not truly what's out there. There are famous examples, like, do you remember that thing with the striped dress that went around Facebook? Just Google it, striped dress Facebook colors. People were seeing completely different colors. And you can look up optical illusions to find a lot of other examples that really show you the tricks your mind plays on your mind. There was another recent example that I really enjoyed about sound. And you also find auditory illusions. And you find that different people hear different things. You hear me speaking with a German accent, right? Well, I don't hear it. To me, it sounds like no accent at all. And it always has sounded like no accent at all. Even when 10 years ago, I could barely separate the V's and W's and all the THs were a complete mess. I started noticing that my accent was improving because when I heard my father speak, I suddenly heard a German accent, where before I didn't hear it at all. What the brain consistently does with all sensory input is run it against what we expect to see, what we expect to hear, and that is all based on our previous experience, of course. So, in regards to language, I have experienced specific sounds, so I expect those to show up again. Anything that comes in is so distorted by how people make a sound, by all the other sounds in the environment, that the brain really has a hard time filtering it out. And so what happens is that a sound is being created based on my experience. And that's why it's so hard to learn another language once your experience has already been formed over decades. For a child, it's really easy because a child picks up new sounds all the time. So the experience and the expectation aren't that fixed yet. Now, the same thing happens in regards to all sensory input, including pain. So when you talk about pain being a hallucination, I would not agree with that. But other than vision and sound, it is hard to find the agreement of others. So we can't say it's a hallucination if you don't agree with the people around you, because that needle pricking your arm is just your arm. When you do the same thing with somebody else, it might still be that they have something else going on in their tissue. It might be that they have some local inflammation. So you can't just make the comparison as easily as when you're talking about the house you see out there. That creates a problem in how we talk about pain and whether we think that somebody's pain level is adequate to what we think actually is going on in their tissues. So, what I want to say is sure, you can say that everything is hallucination, but then it doesn't make sense to use that word at all. So let's just say we use hallucination for auditory and visual experiences that don't agree with the ones of people around us. But we can't apply the word hallucination to pain at all.